Well, it's a great pleasure to be here I'm going to talk about a slightly different topic. What I'm going to talk about is the methodological issues in evaluating the impact of marijuana laws on traffic crashes. So we're all talking about promoting these laws or various approaches to drug driving. But when the push comes to shove, we're going to be called upon to actually evaluate what kind of an impact we have on this. And this started off as an exercise in the US where we were looking to submit a proposal to evaluate laws, marijuana laws, and their effect on drug driving. And we put in a proposal saying that you couldn't do it. And here was a way that you needed to improve the basic information system. And as a result of that, they then commissioned me as the booby prize for not getting the grant to write a policy paper on the whole issue of how we evaluate drug driving. And that's where this talk has been adapted now, and we're going to be also taking a little ride through what I've been able to glean from some of the New Zealand surveys. So this one here. Good. So a little bit of background. Driving, we obviously know it's probably a big issue. The leading drug is marijuana. And there's a whole lot of different laws and legal penalties for drug-impaired driving can influence marijuana use. And also the whole legalization issue in the US. And the interesting thing is, well, what has been the effect of these laws on actual marijuana-related impaired driving? So the laws regarding marijuana use are changing rapidly. The medical marijuana thing is just exploding all around the country, multiple states. Started off in California. And now many incredible number of states have got this. And then, so that's the medical marijuana. And then you come to the whole marijuana legalization. And just this last election, Oregon, Alaska, and DC passed it. But DC's got a barrier of a very conservative Congress, and they won't let them pass that law. So that probably won't take place. So, but the important thing, well, what effect have these had on traffic safety? And I'm not going to be talking about risk, any of those kinds of issues, but so, well, how could we evaluate what impact these might have on traffic safety? Well, obviously one effect is reduced perceptions of risk of harm, and so probably we're going to get increased use, and that's probably a given. But what effect do these laws have on motor vehicle crashes is unknown, and then what data and how could we actually evaluate these? So what I did is we took a look at the methods available for evaluating the effect of marijuana use on drug-impaired driving. And most importantly, you've got to look at, well, what data is available? Because we can't do time travel and travel back and say, oh, we've got to set up this data system and do all these wonderful things. We don't have that luxury. So what we wanted to really, we have to rely on the available sources that we do have. And what we do have is surveys, is the sort of typical approach people have been talking about. And then we've got drug testing data that we've had. And so do we have good, reliable drug testing data on injured people, for example? And so this is really essential if we want to try and look at any trends as a result of these changes in marijuana laws. So I took a look at the different kinds of surveys. There's something in the US called the Youth Risk Behaviour Survey. There's also there's a youth survey done here in New Zealand, also along the similar guidelines. It's in students in grades 9 to 12. And it's a representative survey, and the big part is to be able to, most of these laws are taking part in states, so you actually need state-level data to be able to do this. And they ask a general marijuana use question. During the past 30 days, how many times have you used marijuana? So it doesn't tell us anything about marijuana and driving, but at least it gives you some idea of, and John talked nicely about the self-report issue. But if the question stays the same and the survey is done the same, then hopefully we're going to get some trend data. We don't know what the exact level is, but then maybe we can at least look at the trends. And, but not specifically doing driving, and you can look at state-level data. And for example, there was one study done that looked at medical marijuana laws on 30-day use of marijuana as reported by the survey, and they didn't find any effect that these laws had on 30-day use in teens at school. Then the next survey we looked at is Monitoring the Future survey, which has been talked about, and Faye talked a little bit about it. It's a high school seniors 12th grade nationally representative survey. And there they asked what I begin to think of as some of the coming to close to the sort of ideal kinds of questions. During the last 2 weeks, how many times have you driven a car, truck, or motorcycle after smoking, they had alcohol, after smoking marijuana. And the big thing there is they separate out the marijuana from the other illicit drugs, which many of the other survey questions don't do. And so it's got valuable data on national trends over time. And for example, from 2001 to 2008, driving after using marijuana in the past 2 weeks declined from 14.6% to 10.4%. So this is trend data. We know it's trend data. But if anything, they're going to be more likely to report, it's more socially acceptable to report marijuana use. So we can begin to think that this is starting to provide some very useful data. However, the problem is it's only 2,000 people across the whole country, which is great for a national estimate, but you just can't even think about doing any state level estimates. But it's getting there to show us the kind of stuff that we could do. And this is the typical kind of thing that they get each year. You can monitor high school, past month marijuana use by high school seniors. So that's the typical kind of thing. And you get dramatic variation. And these variations do correspond with other use surveys and even with measurements and those kinds of things. So then looking at the big national drug survey sponsored by SAMHSA, which is the Substance Abuse and Mental Health Administration. This is respondents aged 12 and above. They have a lot of people, 70,000 people a year, so you can actually get some good data. They have a question about driving under the influence of illicit drugs. During the past 12 months, have you driven a vehicle? And a combination of alcohol and drugs, while influence of alcohol only or illegal drugs. But the problem is, I'm interested this time on marijuana. We don't separate out what the drug is. It could be anything. And they do generate some state estimates, and you can get that from that. And this is the interesting thing to me, and it's part of this recurrent theme. Alcohol is not the same problem as drugs. This is looking at the percentage driving under the influence of illicit drugs. Oops, I'll go back. Okay. Oy. Here we go. That's it there. I don't think the clicker works that well. But anyway, the most important thing is that the same states that have drunk driving problems are not the same states that have drug driving problems. There's big variation. And I think that's an important thing. Another consideration, that it's not the same people or the same states that have an alcohol-related driving problem as have a drug-related driving problem. Okay, so this is looking at what kind of data we're getting. They're reporting 4.3% reported driving under the influence of illicit drugs, and 13.2% reported driving under the influence of alcohol. So this is interesting because this is in marked contrast to what we're seeing in the National Roadside Survey, for example. The rates of drug driving, they vary widely by state. It was highest in Rhode Island and lowest in New Jersey, out in Iowa. And the rates of drug driving also varied widely. The trouble with this is that the annual estimates by state are unreliable, and you can do some pooling, but you can only get as much as 5 years, and that's not going to be very good for monitoring trends. So what about marijuana involvement? We've all heard about John's National Roadside Survey become a major policy driven, and it really was one of the things that brought this whole issue out. But then, so that's survey data, which is very valuable, and I'm not going to spend any more time on that. But they were able to do some interesting stuff in California because there they actually had multiple sites over multiple years, and so they've actually been able to start to begin the process of evaluating the sort of state law in one state only. But you can't look at the different laws in different states that way. And what about injured drivers? And this is why I work out of a trauma center in Baltimore. We're probably the largest trauma center in the world. We have about 7,500, 8,000 trauma admissions a year. And we would love to get drug testing on all of the drivers that come into shock trauma. And I'm going to show you a little bit of data that we've got from a pilot study that we've been doing. But basically, we hunted around. We couldn't find any good longitudinal group of people that have been testing it. And that's the same, I think, pretty much all around the world, anywhere you go. And to me, that's a huge data gap if we're wanting to talk about this issue. Then we come to the FARS system that Faye talked about, and in my opinion, it's an absolute disaster. Basically, the drug data in there is not even worth analyzing, in my opinion. There's so many inconsistencies. People have included, for example, Maryland is one of the states that has a high rate of drug testing. So people say, oh, great, we can look at drugs in Maryland. they just don't happen to know at a local level that our medical examiner doesn't test for marijuana because he says no one ever died of an overdose of marijuana, and as a result of it, my tight budget, I can't afford to do the testing, and so I'm just not going to test marijuana. But then the people doing the studies don't know that, and so we underestimate, if there was a risk, we'd underestimate marijuana. There's no uniform testing for panel drugs. There's no rules whatsoever. At least in Canada, where Doug is, there's a limited number of medical examiners, and he's beginning to come around with the whole process of how you get standardized testing. But what they do is they report whether a drug is positive. They don't record what part of marijuana. It could be the inactive metabolite. Some places just test the urine, and that turns positive, stays positive for 30 days if you lock a chronic user in a lab, as Marilyn Hurstis at NIDA has done. So basically, as far as I'm concerned, the data is absolutely useless. And I'll go out on a limb on that one. This is just to bring in perspective what you can get by testing at a trauma center. We have a study where we're looking at the effect of hangovers on crash risk. And I must put a caveat, these are people who volunteer to be part of the study and to be interviewed. But with this, we're doing the same drug testing protocol that John uses in the National Roadside Survey. And 5 minutes, 4 minutes, good. I think we'll get through that. And with that, we're using the exact same testing protocol, a standard lab, good results, and we hope to at some stage get into a larger study where we could do some comparisons. And as you can see here, 7.5% have THC, which is tetrahydrocannabinol, the delta 9. And then there's the 11-hydroxy, which is also an active metabolite, and that's reported in a smaller number. And then some of them have only an active metabolite. And so these are people that could have smoked a whole long time ago, so we don't know anything about that. But so we could roll all these up together and report our 9%, or do we report the 7.5%? Or do we include the active metabolite? So these are part of the policy issues we're going to have to decide. And the interesting thing in this is that only 3 out of the 18 positive cases we have had a BAC above 0.02, basically a detectable BAC. And so there's some interesting things in some of the economists are writing these articles now that if we were to move people from alcohol to marijuana, we might actually reduce the roadside fatality. There's some fascinating things. I've been trying to look at those. So I just want to make people aware that this is a problem, and we've got to have good data to be able to look at this. So we don't have any longitudinal testing on our people, and that's a problem. So looking at the laws, 15 states, this was a little bit old data, had drug per se laws. And then when we looked at it, could the FARS data be used to measure and to evaluate these laws? And this is how we started our actual project originally. Well, we find out that they don't test consistently. I think I've talked a bit about this. Historical data is inconsistent. The interesting thing in Washington State, for example, they changed their testing thresholds. So at one stage, you might have had a 2 nanogram threshold for your tests, and now you've gone down to 1 nanogram, and so you increase the number of people with marijuana positivity, and you've got to put that into your adjust for that and look at that. So that's why it's essential we try and get actual levels of the drug, not just whether the test was positive. So among these 15 states with drug per se laws, only 5 of them tested more than 75% of the driver fatalities, but then only 3 had any longitudinal data on THC. In other words, when we went back over time trying to look for it. And I mentioned this inactive metabolites and the whole metabolite, I covered that issue. So, well, now bringing it back, coming to New Zealand, I always dislike it when the foreign talk comes and gives a talk and says, oh, we're just talking about the US. So I started hunting around on the web for what we've got in the New Zealand surveys. And I was looking at the drug questions that we could begin to try and evaluate some trends here and to provide some advice and recommendations that we're going to lead to next. Because I think I've got about 1 more minute. Yep, got 1 minute. They have one question: in the past 12 months, how often do you drive a car under the influence of cannabis? So these are some really nice, these are the kind of questions that I would like to have. And this has since been replaced by the annual New Zealand Health Survey, and they add special modules every year. But fortunately, the next, this current one for 2012-13 has very much the same question, so we might be able to look at some trend data. but we don't know when the next one is going to be, and to me that's part of my recommendation as we move forward on this. Other New Zealand, there's a series of other surveys, drug driving in New Zealand, done by the New Zealand Drug Foundation. It was an internet survey. They asked their question, and then the road transport is recently funded, and the report's just been published of another one using sort of mixed method prisoners, a bunch of different kinds of approaches, but none of it longitudinal data, and it's not going to be able to contribute to us understanding what's going on. So then you come up with these wonderful study that Helen's been presenting, and I've been following them regularly in the journals, and I came away really excited that New Zealand was testing the fatalities much better than the US, and I said, yay! I've since got some reserve, and we'll get into talking a little bit about that afterwards. So what are my conclusions? Several surveys assess marijuana use, but not in relation to driving, or we can't get state-level data. And New Zealand has questions with multiple surveys with different methodologies, but I think this New Zealand Health Survey and the original ones is really very encouraging. We have limited drug testing across the states in the US, I mentioned. I thought New Zealand was doing much better, but we'll talk a bit about that. We don't have any good data on non-fatal injuries, though, and I think she presented some, but it's not a representative sample. It's the people, there are all these other caveats, which she explained very nicely. So lack of reliable data on longitudinal data is really a major issue that we have to deal with. And if we're going to think about evaluating this, we have to be thinking about what we're going to do. The cost of testing is a major problem. And my last slide, just to wrap up. Reliable drug testing is essential. Cost is a major issue. We need to be thinking about these surveys and including drugs and driving. It's much cheaper to add a couple of good drugs and driving questions to a major health survey than it is to go and design our own one-shot survey to some Beltway bandit who's going to go and sort of collect the data and throw it away and have no institutional memory. The Colorado Behavior Risk Factor Survey, which is one of these good ongoing surveys, added some very nice questions on marijuana and driving, and they're going to be able to monitor some of the trends there forwards, not backwards, unfortunately. Fatality question, the big problem in the US, and that's something I'm personally trying to work on, is trying to get much better data for the fatalities and trying to link together the tox data that's sitting in one silo versus the highway safety data sitting in another highway. New Zealand, monitoring trends in New Zealand. To me, this is something that at the least in the levels of fatality should be going on. And I was horrified to hear that the cost of testing and these other issues is becoming such a big issue. So to me, that's a real national priority. And I'd like to see hospital testing and then also roadside surveys. You can't forget that. That's provided some other very valuable data. So if we're thinking ever about trying to evaluate this, we have to think about these issues. Thank you.